Okay, thank you very much. Many details about the kind of the nitty-gritty of doing this stuff. One thing that we are trying to do is just putting all those kind of details in a protocol paper and putting that for peer review process. We are still receiving feedbacks and comments and revisions, and there are still lots of minor details to be optimized in this process. But the next two speakers that we are going to have are from kind of the young generation of what we call ISAM-GEN assistant officer. So that is an opportunity for younger students and people who are in their kind of junior career to be involved with ISAM Global Expert Network. And we already have few of them here. And I would like them to just stand up here. I can see Parnian, Hossein, Fatemeh, Arash, and yeah. They have been kind of involved in making that happen as kind of new fresh blood to the field, and we invite others, I mean senior figures, to encourage their students, their younger colleagues to be involved in this process, and they have been involved in the kind of decision-making process. And two of them are going to present today. I think that Fatemeh is going to start first, and then we'll have Arash, and then I will have kind of a wrap up about what will be the next steps, how we can go for the next level. Fatemeh, please.
Hello, everyone. Good morning. I'm Fatemesadat Abolghasemi. Long name, middle name, and last name. You can call me Fatemeh and whatever you want. I am a final year medical student and ISAM-GEN assistant officer, and also ISAM General Council communicating officer. I'm so honored to be here with you. I am actually here on behalf of my other colleagues and ISAM-GEN officers. You can see their beautiful faces here in this slide. They couldn't, all of them, make it here. Okay, the thing to start, the thing that I'm going to talk about today is where does ISAM-GEN stand between other ongoing efforts globally, and we're going to go through some organizations that are running surveys, they're producing questionnaires and those guidelines, similar to the thing that are being done in ISAM-GEN. You can see the names in here, for example, WHO, UNODC, and the rest of them. And they're gonna go through very details and just gonna give you a common knowledge about them. Okay, the first one is conducted by UNODC. It's a global assessment program on drug abuse. It's actually a more government-based. They aim to assist member states to develop capacity to monitor patterns and trends in drug abuse, to encourage the adoption of methodologically sound and comparable indicators of drug abuse, to support the development of expert technical networks at both national and regional level, and to facilitate design, implementation, monitoring, and evaluation of evidence-based demand reduction responses in areas of prevention, treatment, and rehabilitation, and reducing negative health and social consequences of drug abuse. This global assessment program conducted by UNODC is actually conducted in 8 modules that mostly focuses on drug information system, prevalence, school services, data management and collection, the epidemiology, and drug treatment demands. And they're conducted in 4 or 5 languages worldwide. You could use them. Here you can find the questionnaire, the annual reports questionnaire. As you can see here, the report is government-based. And it's like they're actually asking people in authority in the governments to fill the form and provide with the information. Just one note thing that it could be like this thing, personal tastes could be interfered with this providing information, and the methodology could be like sometimes somehow a little bit vague. Here you can find the annual report questionnaire that consists of the following 4 parts. The part 1 is about legislative and institutional framework. The part 2 is about comprehensive approach to drug demand reduction. And the next one is extend patterns and trends in drug use. And the last one is extend and patterns of and trends in drug cultivation and drug manufacture and trafficking. You can see it's the sheet that is being sent to the governors, and it's actually provided in different sheets. They fill the form, the whole actually file, and send it back to the UNODC. The next joint effort is conducted by WHO and UNODC, and it's they actually develop an international standards for the treatment use of drug disorders. And as you can see in the title, the key principles are actually provided mostly focused on the treatment only. Here you can see this treatment facility survey introduction that it's being conducted to actually, as I said, mostly focused on treatment of substance use disorder. And the data may be used for mapping of services in the country or region, or develop a register for a general public, for research also, or as a basis for treatment availability, accessibility, and quality monitoring. Here on the left side, you can see overview of the key quality standards for the appraisal of drug treatment services. As you can see, it's conducted in like 4 different categories. Effective management of the service, and the next one is individualized patient-centered treatment and the care. The next one could be timely access to evidence-based interventions. They all, as you can see, have subcategories for the assessment and things. And the last one is promotion of patient health, safety, and human rights. On the left side, as you can see, it's like this joint effort is actually also conducting the treatment services with self-assessment, self-quality assessments for them to actually get to know about their limitations and strengths, and for better develop their actually activities. And you can see more detailed questionnaire in here, and I'm not gonna go through the very details, but these are the things that could be used in our further let's say collaborations with each other to use these guidelines and standards. Of course, be privileged of them. The next organization I'm going to talk about is Global Drug Survey, which is said to be an independent research company based mostly actually in London, that they use the data for the they provide the data for the patients for screenings and brief intervention, and also for the professionals as they educate like the wide range of they provide the experts via the range of drug education materials. These organizations is actually claiming that they run the largest drug survey in the world. They actually their target population is normal population, and that's why they mostly focus on prevalence and those kind of things, that treatments or analysis. They're more likely like descriptive prevalence. As you can see, for example, on the left side, it's Global Survey 2021 report that is claiming that alcohol use is the most, let's say, substance being used all over the world. So the data are most likely to be descriptive prevalences. And I could I had this one question as a sample from their surveys that how would you describe your overall mood and mindset before you started using this drug on the day you saw it. And you can see it's like prevalences and asking the individual people that are dealing with that thing. The next organization is EMCDDA, as you're already aware. And EMCDDA is having data sets. I actually, of course, provided only about the Europe area. And these data sets are talking about prevalence of drug use, overdose, death, infectious diseases, etc. And the methods and definitions are clear. And one thing, one interesting thing about these data actually provided by EMCDDA is their beautiful visualization using these all graphs. You can see they're really informative. And the next and the last one is national surveys of substance abuse treatment services, which is run by Substance Use and Mental Health Services Administration, run by U.S. Department of Health and Human Services, or SAMHSA, as you can see. This organization is like getting the information from treatment services, treatment centers, and they actually provide the results in trends in facility characteristics and trends in client characteristics, and analyze the results and give them back to, again, treatment centers for better improving their activities. And here you can see the sections of the survey, the questionnaire. Section 1 is about, for example, faculty characteristics. Section B is reporting client counts and hospital independent client counts. Just to wrap up, in ISAM-GEN, it's like we are having, as pretty thoroughly explained, we're having 4 kind of like target population. It's individualized experts, it's addiction medicine society heads, it's treatment service heads, and also governors and people in authority. And we are aiming to have them as our target population in our surveys, and also to better facilitate the processes of decision making and policy making, and to better actually aiming to with an eye toward developing the World Drug Report annually. Thank you.
Hello, everyone. This is Arash Khojasteh. Thanks. It's a real honor to be here today with you. So I am an assistant officer at ISAM-GEN. I'm actually the data analytics officer in ISAM-GEN. And today I'm going to talk about one of the steps that we have in our protocol paper in order to realize if we are on the right path, which is running a pilot study in between what we already have in our network currently. But before that, we already know that where we're standing, what's the ISAM-GEN structure, as Dr. Preeti perfectly mentioned, and as Fatima also mentioned, we know we're monitoring other efforts globally to see what are others doing and trying to look widely and try to provide everything that we can within ISAM-GEN. So in order to see that as our first effort, starting within ISAM-GEN, we decided to run a pilot survey within the expert network that we already have, and we collected through all the things that we mentioned before. We decided to target a subject which is really important in the field, which is related to opioid use disorder. We decided to target opioid use disorder treatment, and we actually designed a survey through many parts, many rounds of commentings. As you can see, this is the version 20.1. We went through a lot of editing with our steering committee within ISAM-GEN with the great help of the assistant officers and everyone. And we actually put together a pilot survey in 2 distinct phases. which I assume many of you have already received the first part and you've already actually participated in the first part. In case you've not, we have sent reminders and you still can reach out to us. We will surely send you the first phase again. And we actually designed all the questions related to opioid use disorders with different types of questions, including multiple answering questions and open short answer questions, some other expert elicitation methods we're trying to use. We also had a workshop on expert elicitation methods on trying to see how we can use different methods when we are reaching out to individual experts and we want to collect their opinions. And we are trying all of these things in these pilot surveys to see which are working the best for us within ISAM-GEN. So the global survey on treatment service provision for opioid use disorder had 5 main sections. The first section definitely is about the demographic questions. And the second part is about the prevalence of opioid use before getting into directly to the treatment. Then we got questions about opioid use disorder treatment related questions. We used other surveys. We monitored other surveys. We gathered all the questions in a database. We monitored them. We discussed them in meetings within our steering committee, within our assistant officers. And the fourth topic that we covered is about opioid use harm reduction, and the 5 was about survey contribution. We asked actually the target population in this survey were addiction societies. So each addiction society had a representative that we targeted. As you can see, this is what we do in the background, in the backstage actually. These are all the societies that we listed, and we reached out to them in several within several reminders, and we tracked their responses. We emailed back to see who's responding, who's not, as you can see in different continents. So we received different answers from these societies, which were one of our group of target points in ISAM-GEN. And this is the map showing the country of addiction society organizations who participated in our pilot survey, which is quite good enough for the pilot survey. We were aiming to improve this by actually doing the more snowballing samplings to actually have more experts in our network. But currently, this is what we had for our survey. So as I mentioned before, we had the first phase and you have already received it. We are working on the second phase. As you can see, here's the second phase. We're working with our ISAM-GEN assistant officers. As you can see, we share, this is the email email circulation that we have with our officers. We share the surveys. Everyone goes through the survey before reaching out to the experts and to the societies. We all go through the surveys. We share our comments. We share our thoughts. Then we will discuss everything within our steering committee. Everyone is also invited to read again the survey and see, because this is a pilot survey, and we want to see that if we are on the right track. So as the last slide, and one of the most important things that we want to mention, is really an honor for us. Now we have the new collaboration with the international, actually with the World Psychiatric Association, which is, we are collaborating together to get involved, to have the other potentials that WPA has within their network of societies, experts. We're trying to merge all these things and empower the effort that we're trying to make together and have better surveys, better group of experts together, and try to empower all the things that we have in ISAM-GEN. And here's again the ISAM-GEN flowchart, and that's it. Thank you.